Hi, this is Anna from Parents Fidelity, and we are the international agency which is working together with our partners, IVF Center Parents Ukraine, and we are happy to assist you with any IVF or surrogacy treatment. Today, we are going to talk about the IVF with donors material. First of all, I would like to tell you that the egg donation in Ukraine is totally anonymous, which means that you won't be able to find out the contact details of your donor or meet her, but you will be having all another information to select your perfect one. For example, you will have all the general information. You will know the color of her eyes, hair, the blood type, her hobbies, education. You will get the information about her family. This all will be accompanied with the photos, her adult photos or child photos, so it will be easy for you to choose your perfect egg donor. Thanks to our cooperation with the IVF Center Parents Ukraine, we can be sure in the quality of eggs we are offering to you. I would like to tell you more about the egg donors which you can select. According to the Ukrainian legislation, an egg donor has to be a woman who has already given a birth to at least one healthy child. Her age has to be in the range of 18 to 30. She has to be totally healthy and have no bad habits. Her health will be closely evaluated by the IVF specialist and all the medical staff in the IVF center. She will be doing various tests. The doctors will check her hormone levels. She will be having her smears done. We will check whether she has any diseases, including genetic ones. Once we get all the results and the doctors are 100% sure that she is a good candidate for the egg donor, we start offering her to our patients. At Parents, we offer two types of egg donation programs. It can be vitrified eggs or fresh ones. In case with the fresh egg donation, the doctor will synchronize both your and your egg donor's menstrual cycles to make sure that you will start your preparation to the program approximately in the same days. The doctor will do this by using the birth control pills, which you will need to take 1 month before the start of your stimulation. In both fresh and vitrified programs, you will get 10 mature donors' eggs. The only difference between these programs is that in case with the fresh egg donation, you will get 10 fresh and mature eggs after the egg collection. And in case with the vitrified program, we will warm these eggs at the day of the fertilization, once the doctor tells that you are prepared to have the embryo transfer in approximately a week. Regardless of the type of the program you choose, you will need to start with the medical evaluation, which means you will have to do the medical testing. You can do it at home, or you can come to us for a few days and do everything in one place. We will also need to make sure that your partner's semen sample is already at the clinic at the day of fertilization. Now let us focus more on the fresh egg donation and the whole process. As I have mentioned before, both your cycle and your egg donor cycle, they will be synchronized. Your stimulation will take from 18 to 22 days, while the donor will be having her ovarian stimulation for approximately 10-12 days. The doctor will closely monitor your progress and your egg donor's progress, and she will make sure that everything goes according to the plan. You will be having the date of your embryo transfer approximately a week before it. We will inform you on the day of the egg collection of your egg donor, and at this day we will use your partner's sperm to fertilize them. For the next 5 following days, we will be closely observing the development of your embryos and will be informing about the progress. The preparation of your uterine lining has to be done under the control. We are always happy to see you at the clinic for this, but if it is more comfortable for you, you can do it at home. But we will be waiting for you at the day of the embryo transfer. In case you will select the IVF with the vitrified donor's eggs, you will start the preparation of your uterine lining from the second day of your menstrual cycle. In the course of the stimulation, you will do several ultrasounds, and once the doctor sees that you are prepared for the embryo transfer, we will schedule the date. In case you will select the vitrified program with donor's eggs, you will start the preparation of your uterine lining from the second day of your menstrual cycle. Your progress will be closely monitored by the IVF specialist, and once she will see that you are ready for the embryo transfer and that we can schedule the date of the embryo transfer, the doctor tells embryologists when to warm your donor's eggs. And at this day, embryologists warm 10 mature eggs and fertilize them with your partner's semen. Before that time, we need to make sure that the semen sample is already at the clinic. For the following 5 days, the embryologists will monitor the development of your embryos, and we will be able to do the embryo transfer on day 5. If you do not have the possibility to do the transfer in this cycle, or the doctor gives you such kind of recommendation, we can postpone this process. In addition, we can do the PGD testing on these embryos if you have such an indication, or it is important for you to know that embryos are totally healthy. I would like to tell you that this process takes up to 21 days to get the result, but you will be sure that you will be transferring healthy embryos. In 10 days, you will do the HCG test to confirm your pregnancy. And if everything is good, the doctor will schedule the first pregnancy ultrasound, where we will hear and see the heartbeat of your baby. We will surely support you after your treatment. We will help you with everything decently as long as you will need us. Your personal coordinator will help you throughout all the process and will become your support in this. So that was the main information about the IVF with donor's eggs. We will be happy to discuss it with you in person or through video conference. So we are waiting for your call.